Have you ever wondered why, even though you've tried so hard and cared so deeply, when intimacy comes, the woman beside you gradually becomes quiet, distant, or even avoidant? Have you ever considered that, perhaps for many years, you believed you were doing everything right, but her body never truly felt that way? And the most unsettling part is this. If the truth lies in physiology rather than emotions, very few men are ever taught how to understand it. I'm Dr. Emily Carter, a urologist specializing in men's health. For more than 30 years working with middle-aged and older couples, I've heard the same concern again and again. I love her, I want her to be happy, but I don't understand why things aren't the way they used to be. The truth is, most men believe they know what women want in intimacy, but medical science shows that many are mistaken, not because they don't care, but because no one ever explained it correctly. This video isn't about tricks or cinematic fantasies. We're going to talk about real bodies, real physiology, and the positions women genuinely enjoy because they align with how their bodies actually feel, especially after the ages of 40, 50, or 60. If you're looking for a deeper, safer, and more natural sense of connection, stay with me until the end of this video. If you find this content helpful, consider subscribing so you don't miss future videos. And if while watching, you find yourself thinking, so that's it, leave a number 1 in the comments below. If you feel the video offers no value at all, a 0 is perfectly fine too. I truly value honest feedback. Now, before we talk about any positions, there is a foundational physiological truth, one that, if you don't understand it, makes everything that follows meaningless. And that's exactly where we'll begin next. There is a truth that leaves many men silent the first time they hear it. Not because they're shocked, but because they suddenly realize they've been putting their effort in the wrong place for years. Most men believe that female pleasure works the same way theirs does. The stronger, deeper, and faster, the better. But a woman's body, especially after midlife, does not respond to that language. In physiological medicine, female pleasure doesn't begin with movement. It begins with conditions. Those conditions are steady blood flow in the pelvic region and continuous stimulation at the front of the pelvis, even while there is internal movement. When these two factors don't occur at the same time, sensation doesn't disappear immediately, but it becomes diluted, like a wave that fades before it ever has a chance to rise. Many couples I've worked with mistakenly assume that a woman's silence means a loss of desire, when in reality her body no longer feels safe enough to respond. And here's the point where you need to pause and reflect for a moment. If for all these years the issue hasn't been about feelings, but about the way you've been speaking to her body, what might happen if you change that language? Up next, we'll begin to understand why some very simple positions can create deeper sensation than anything flashy or exaggerated. If you miss this part, everything that follows will lose its meaning. Before we talk about any specific positions, we need to pause and look at a general principle. Because without understanding this, you could change positions for a lifetime and still see no real difference. In clinical practice, I've learned that women don't fall in love with positions. They fall in love with the sensations those positions create in their bodies. What the positions women consistently rate highly have in common is not appearance, but the ability to keep their bodies relaxed. When the hips, lower back, and pelvic area don't have to tense up to adapt, the nervous system shifts from a state of control into a state of receptivity. At that point, blood flow becomes more stable, sensations become clearer, and the body's responses emerge naturally. Many men mistake silence for a lack of feeling. In reality, when a woman's body is truly receiving sensation, she often needs less outward reaction. This is the moment you need to ask yourself a very important question. Are you trying to create pleasure, or are you creating the conditions for pleasure to arise on its own? It's from this principle that positions which seem simple on the surface become the foundation for deeper connection. And the first position that often delivers this isn't the most powerful one, but the one that makes the body feel safest. Many couples are surprised to learn that one of the positions women enjoy most is a side-lying position. Simple and almost unremarkable on the surface. From a medical perspective, however, this makes complete sense. When lying on the side, body weight is evenly distributed, the hip joints and spine aren't compressed, and the pelvic area maintains its natural stability. This stability allows movement to be shorter, smoother, and more controlled. More importantly, the position makes it easier to maintain continuous contact at the front of the body, where sensory nerve concentration is highest. When that contact isn't interrupted, sensation doesn't break, and the brain can more easily remain in a receptive state. I've worked with many couples over the age of 60 who shared that they felt more connected in this position, not because of intensity, but because they were able to stay with the sensation long enough to truly feel it. And here's a question for you at this moment. How long has it been since you stopped rushing, stopped trying to go further, and simply stayed fully present in a moment that felt comfortable and complete? When you begin to understand the value of stability, you'll start to see other positions through an entirely different lens. There is one position that many people think is too familiar, to the point that they overlook its true value. It's the face-to-face position, where two bodies are close, breathing naturally falls into sync, and eye contact remains unbroken. From a physiological perspective, this position strongly activates oxytocin, the hormone responsible for bonding and the feeling of safety. When chest meets chest, breathing patterns tend to naturally regulate with each other. This calms the nervous system, reduces unconscious tension, and helps blood circulation become more stable. One very important detail that many people miss is that in this position, even small adjustments to the internal angle, such as a slight lift of the hips or a subtle change in tilt, can create a significant difference in sensation. The emotional peak of this moment lies in a realization that very few people are willing to face. Sometimes what makes a woman feel most desired isn't the movement itself, but the feeling of being seen, of being fully present together in that moment. If this connection is missing, do the more intense parts that follow still hold any meaning? And once trust has been established, some women begin to want more control over sensation. That's when the next position begins to show its strength. Across many clinical surveys, positions in which the woman takes a more active role are often rated more positively among middle-aged and older age groups. The reason isn't novelty, it's the sense of control. When a woman can adjust the angle, rhythm, and depth herself, her body no longer needs to stay in a defensive mode. This sense of agency reduces anxiety about discomfort or pain, especially in bodies that have undergone changes over time. What's interesting is that when worry fades, sensation often becomes easier to access. Pleasure is no longer something that must be achieved, but a natural outcome of feeling comfortable and at ease. Many men worry that their role will become diminished in this position. In reality, the opposite is true. When you remain grounded, steady, and non-pressuring, you create a safe foundation for her sensations to unfold. And it's precisely this safety that deepens the connection between the two of you. If by now you're beginning to realize that pleasure isn't about who does more, but about who listens better, then the next part will help you understand why some positions that seem powerful on the surface can actually backfire when they're missing the right adjustments. This is the position that sparks the most debate in my clinic. Some women say it feels too deep, too forceful, creating tension instead of enjoyment. Others, however, describe it as the position that delivers the clearest sensation. The difference isn't the position itself, but how it's performed. From a physiological standpoint, when the angle of contact is directed straight backward, pressure concentrates on sensitive areas that are more likely to cause discomfort. But with just a very small adjustment, such as changing the tilt of the hips or adding proper support, the direction of contact shifts toward the front of the pelvis, where the female body receives sensation more comfortably. In that moment, it's the same position, but an entirely different experience. The reflective peak of this section comes down to one question. Are you trying to go further, or are you trying to go in the right direction? Many men believe that simply reducing force is enough, but in reality, without adjusting the angle, slowing down alone may still fail to solve the problem. And from here, we begin to see a deeper truth emerge. Not every position is right for every situation, especially those that have been glorified by film and fantasy. Many people enter intimacy with an unconscious image in their minds, that the more impressive a position looks, the more it proves passion. But the real body doesn't operate by the logic of a screen. In clinical reality, positions that demand a lot of strength, balance, or muscle tension often push the nervous system into a state of alert rather than pleasure. When the body has to focus on staying balanced, preventing slipping, or to handle unnatural pressure on the joints and lower back, pleasurable sensation is pushed into the background. Blood flow becomes less stable, sensitivity decreases, and the brain begins to prioritize control over enjoyment. This is especially noticeable in women after the age of 45, when the body requires more supportive conditions to feel safe. What's important to understand is that the problem isn't the desire to try something new, it's placing appearance above sensation. And here's a warning worth remembering. If a position causes the body to tense from the very beginning, it's very difficult for pleasure to emerge later. When you let go of the pressure to do it right, you begin to open the door to genuine sensation. And to keep that sensation from being interrupted, there is one important principle that very few people pay attention to. Many people have experienced the feeling of being almost there, only for everything to fade into silence moments later. The reason isn't a lack of desire, but an interruption of sensation. In female physiology, continuity matters more than intensity. When sensation is just beginning to form and then gets disrupted, the brain has difficulty returning to that original receptive state. Couples who experience deeper connection don't move more. They move more precisely. They maintain shared breathing, keep movements short and steady, and allow the body time to register sensation. When pressure remains consistent and contact is sustained, the parasympathetic nervous system is activated, creating the conditions for pleasure to spread and deepen. What's interesting is that very small supports, such as adjusting points of support or modifying position with simple objects, can create a significant difference. This isn't over-preparing, it's working intelligently with the body. And by this point, you may have realized that what truly makes the difference isn't how many positions you know, but how deeply you understand the body. That understanding is also the spirit of the closing message I want to share with you. After many years of working with middle-aged and older couples, I've come to a very clear realization. Aging doesn't take away the body's sensitivity. It simply changes the conditions under which that sensitivity can emerge. When we stop trying to impress and start truly listening, intimacy becomes a dialogue rather than a test. The positions women genuinely enjoy aren't special because they're unusual, but because they respect physiology, allow the body to relax, and help sensation remain continuous. When you understand that pleasure is the result of safety, stability, and presence, the need to search endlessly disappears. If this video has helped you reflect on how you approach closeness, consider sharing it with your partner or with someone you believe could benefit from a different perspective. And if you'd like to continue exploring insights that support health, confidence, and connection in a scientific yet deeply human way, subscribe to the channel and stay with me. Because in the end, intimacy isn't about how much you do, it's about how much you can truly feel. And that is something that can always be relearned at any age.